What if taking care of yourself after birth is just as important as preparing for it? You've just completed the incredible journey of pregnancy and birth. And if you've been getting adjusted during pregnancy, you already know the power of nervous system care. But now that your baby is here, you might be wondering, what's now? Should I keep going? Is postpartum care even necessary? Let's put it this way. Would a marathon runner train for months, cross the finish line, and then stop caring for their body entirely? Of course not. Recovery is a critical part of the process, and the same goes for you. You spent months preparing for your baby, building the registry, reading the books, maybe even crafting a birth plan. But once that baby is in your arms, the world's attention shifts. And yet, this is the very moment your body, brain, and nervous system need the most support. From hormonal crashes and sleep deprivation to breastfeeding challenges and emotional overwhelm, the postpartum season can feel like a whole new storm. That's exactly why we're having this conversation. Postpartum chiropractic care supports your healing, not just physically, but neurologically. We're going to walk through how birth impacts your nervous system, how that can contribute to mood swings, fatigue, inflammation, and more, and how gentle, specific adjustments can help you heal, regulate, and thrive during this vital season of transition. Because your healing doesn't stop when your baby is born, and you deserve care that honors that. And here's where it gets real. While the beauty of birth gets a lot of attention, the aftermath often doesn't. Studies show that 10 to 20% of moms experience postpartum depression. But that only scratches the surface. As many as 80% of mothers report experiencing some form of the baby blues. That's not just emotional, it's neurological. It's a sign that your nervous system is overwhelmed, under-supported, and calling out for help. Birth takes a physical toll as well. Research show that as your baby navigates the birth canal, their head and neck can experience pressures up to 500 millimeters of mercury, an enormous force on such delicate structures. And your body, it's not walking away untouched. Muscles, ligaments, and tissues stretch and sometimes tear. The physical, chemical, and emotional stress of delivery doesn't just disappear after birth. It lingers in the nervous system, and without support, it can quietly wreak havoc. Birth is physically and neurologically demanding for both you and your baby. Your body undergoes immense hormonal shifts, powerful contractions, and intense physical effort. That kind of stress can cause subluxation, where communication between the brain and the body breaks down. For new moms, this often shows up in the pelvis, the low back, the upper neck, and the mid-back, areas essential to healing, balance, and regulation. So if you're feeling off, there's likely a very real neurological reason behind it. And then there's the postpartum hormonal cliff. Within just 24 hours of giving birth, your estrogen and progesterone levels plummet. These hormones don't just regulate reproductive function, they directly affect your brain's chemistry and your autonomic nervous system, which oversees mood, sleep, digestion, and temperature regulation as well. When that system gets thrown off, it can leave you anxious, sleepless, irritable, overheated, or struggling to keep food down, all chalked up to just hormones when it's really your nervous system trying to regain balance. Now, even more important, your nervous system doesn't just affect you, it directly impacts your baby through something called co-regulation. Your baby's immature nervous system looks to yours for cues. So things like heart rate, breathing, stress hormones, and body temperature are all influenced by your state. So when your nervous system is balanced, your baby is more likely to settle, to nurse well, and to thrive. But if your system is dysregulated, they can reflect that distress as well, starting a cycle that's hard on both of you. This is why so many common postpartum challenges are rooted in the nervous system. Breastfeeding struggles often tie back to vagus nerve function. Sleep issues, another near universal struggle, are related to a nervous system stuck in fight or flight mode. Mood changes, anxiety, pelvic pain, incontinence, and diastasis recti, they aren't just physical or hormonal issues, they're neurological as well. And that's exactly where we come in. At E320 Chiropractic, we start with insight scans to get a clear look at how your nervous system is functioning. Now, these scans help us identify where subluxations are disrupting communication in your body and where your system is stuck in stress mode. From there, we use gentle, neurologically focused adjustments to restore balance, helping with hormone regulation, core stability, sleep quality, and even breastfeeding comfort. And of course, we care for your baby too. So pediatric adjustments are incredibly gentle, just like light pressure, like checking the ripeness of a tomato, but they can make a big difference in helping your little one recover from birth, regulate their nervous system, and hit their milestones with greater ease. So if you're in the thick of it, navigating sleepless nights, hormonal swings, feeding challenges, or just feeling like your body hasn't quite bounced back, know this: you're not broken and you don't have to figure it all out alone. Your nervous system is the command center for your healing, for your energy, and your ability to show up for your baby and yourself. And that's exactly what we're here to support. At E320 Chiropractic, we walk with moms every step of the way, not just through pregnancy, but long after the baby is born, because your story doesn't end at delivery and your healing matters. If you're ready to feel like you again, reach out. We'd love to hear your story and help you take the next steps towards healing, regulation, and thriving in motherhood.